Hi, everybody. Thanks for joining us. So for those of you who don't know me, my name is Peter Llewellyn. I run the services at MedComms Networking.com. So information resources, activities for people who work in and around medical communications, medical education, medical publishing, associated businesses across the globe. So I'm having a bit of fun at the moment, as I do from time to time, talking to people across the business and hearing about their personal stories, their MedComms stories. So today I'm joined by Tasmin. And I won't take your thunder, as it were, Tasman. Tell us a little bit about yourself. Start with who you are and where you are.
So my name's Tasmin. I currently work at Avalere Health, where I've been working as a medical writer since December 2022.
Okay, so that's 18 months or so, yeah?
Yeah. Mm-hmm.
Excellent. Okay, so let's go back to the beginning. That's where I always like to start. I know you've got a veterinary background, so that's a little bit different in medcoms, I guess. So let's just go back to that. How did you get into that apart from anything else, and what were you doing there? And then let's talk a little bit about why you went from veterinary medicine into medcoms. But let's start with the studies.
Mm-hmm. So I classically always wanted to be a vet since I was a child, loved animals, etc., etc. So I worked really hard, went to university, did the whole vet thing. I'm also a horse lover through and through, much to my parents' dismay. So I became an equine vet straight out of graduation. I really enjoyed it. I felt really passionate about equine practice and dealing with my clients. So I then went and completed my certificate of advanced veterinary practice in equine internal medicine. As that was going on, I had a baby at the same time. So I went on maternity leave, and coming back from that, I was thinking that I might like a little bit of a change, something that allows a little bit more flexibility, less out of hours commitments, but still maintaining using my skills that I'd earned in terms of communication from my vet degree and dealing with clients. And I also found that I really enjoyed the writing parts when I was doing my postgraduate certificate. So my friend that works at Avalere Health said to me, "You'd be a great medical writer. Why don't you come here?" So I took the writing test, and here we are.
So I'm just going to cut through that. I mean, it was a very serendipitous type of thing. I mean, your friend said, "Come and have a look at this." So you didn't sort of go and look at the landscape and focus in on medcoms and think that's for me. It was a bit more sort of your mate has a chat with you and you think, well, I'll go and find out
Yeah,
what's going on over there. Okay.
yeah. I have to admit, I was yeah, not well versed in medcoms at all. Even when
Right.
I started, it felt completely new to me. If you'd asked me 2 years ago what a medical writer did all day, I wouldn't have been able to tell you. No
Right.
idea. So it was purely by coincidence, and the fact that I have a really lovely friend. I'm obviously very glad that I've fallen into it now. But I think generally medical writing is something that's not well known about at all in the veterinary world. When I've talked to other colleagues about it in the past, they're generally pretty clueless about what I do.
Right. Yeah. Yeah. Okay. Okay. So let's just go through the process a little bit. So, accepting the fact that that introduction was there, I'm assuming that you went through a basic process, writing tests, interviews, and so on.
Mhm.
It's not that long ago. So just tell us a little bit about what that process was like.
Yes, I was referred by Sam, and I spoke to someone from the talent team at Avalere Health, and they sent me along the writing test after I'd sent my CV in. So they gave me some data, and I had to write an abstract, which I'd probably be really embarrassed to read now, but I obviously did the job okay. And I also had to create a PowerPoint slide also to summarize some data. You had to pick out what was best and choose how to present it, which is similar to what you're going to do as a medical writer.
And that was sort of before going on to an interview type process, was
Yes,
it? So
yeah.
the writing test was like the first stage, the screening stage, as it were.
It was, yeah. So you did the abstract and the slide in one. They went off to be marked by a chosen assessor at Avalere Health, and if you fit the bill, then they'd ask you for an interview, and had about a 30-minute interview with a couple
Okay.
of members of the team on Teams.
One of the things that I mean, aspiring medical writers are always very interested in is what's involved in a medical writing test, and how big a job is it, and so on and so forth. I mean, just give us a bit of a sense. I mean, you successfully passed the writing test, which is great, but just give us a bit of a sense of how challenging it was. You said what you did, but I mean, was it a couple of hours work? Was it 20 hours work? Was it, did they give you clear instructions? Just give us a little bit of a sense of how it worked from that point of view.
Yeah, trying to think back to the brief.
Can you
I
remember?
think they did. Might have only been 18 months ago, but it seems like longer. I think it took me about 8 hours to do both. I think might have been less than that. And from memory, they asked you to say how long it took you, honestly, when you handed in.
Yeah.
So obviously, so they got an idea whether you only spent 20 minutes on it and you're clearly not that bothered, or if you spent way too long on it. And yeah, they generally gave you some data, and I think they didn't give you much in terms of guidance about how to write the abstract and how to structure it, and things like what you needed to reference, what data you'd need to include, and things like that. Like, a lot of that was left out, which is things that I didn't know about, given that I hadn't written anything like for a publication before. So,
but I guess what they're looking for is a bit of initiative, and if you can sort of work out and take a common sense approach to it and produce something that's reasonably well written and so on. They're looking for aptitude, aren't they? They're not looking for you at that stage. They're not, because you're not a medical writer at that stage. So they're
no,
looking for the aptitude rather than anything else. Okay.
I don't think you need to be able to tick every box, because a lot of the simple rules, they can be taught. I think really what people are looking for, not that I'm marking any writing tests, but I think what tends to make a good medical writer is someone that can see the whole picture. It's like we talk about, like, the so what. So, well, this data's here. What's the story that we want to tell?
Right.
So can you set out a little introduction? Why are we doing this study in the first place? And then, all the methods that you need to include, and key results. What are these interesting results that we actually really want to present? And then what does it all mean? What's the conclusion? So I think if you can get those key points across, then I think you're doing really well already.
I think that's quite an important message, actually. A lot of people, when they're facing writing tests, worry a bit too much about, they spend too much time on the methods or the detail. It's like, as you say, there's a message in there somewhere. That's what they're asking. And if you can spot the message and communicate that, then you're going in the right direction. Then they can teach you where to sort of like sort your writing out from there on, sort of thing.
Yeah,
so
you can teach you how to do referencing. That's taught.
Okay. So you went through that process, you got your job, and you went, as I understand it, you went into the pub side of the business. Is that right? The publication
Yeah,
side.
so I started in publications, working on an account that deals with the drug for lupus, which was new to me. I knew what lupus was, but didn't know anything else. So did a lot of onboarding, learning about the therapy area, what, in terms of the drug I was working on, the history of it, and where we were kind of up to post-marketing, etc. So then I worked on there. I also did a little bit of medical affairs work associated with that account, towards the end of my time on publications, before I shortly moved over to marketing to work as a medical copywriter, which I started a few weeks ago.
Okay, well, let's just stick with the pub side of it for a moment. So that sort of work, again, just give us a little bit more of a flavor of a taste of what you mean by that. What's actually involved in publications? You tell me a little bit more about what you mean by that, and what sort of actual work you did, and who was involved in that work. Just give us a flavour of your sort of daily working life, as it were.
Yeah, so the clients would give us an idea of what manuscripts and abstracts for congresses they wanted to be coming up. You'd have like a publication plan, so they'd have an idea of what data they've got coming through the pipeline, what projects they've got going on, and how all of these manuscripts, abstracts fit into their sort of tactical publication plan for how they're going to ultimately get their key message across for their drug, what story they want to tell. So we would get a brief for a manuscript, we'd get supplied with some data. We'd usually have a kickoff call with some of the authors, some of which would be usually from the client, and also some external ones, so external specialists. And so like rheumatologists, for example. In my case, we'd then work towards providing an outline. It would go off for review, which would generally be pretty short, so we could kind of get a rough idea as to what the client was wanting us to say. and then go through a few drafts and eventually get hopefully to it being published. And then there's also abstract work, so writing abstracts for data that have been produced very recently. They really want to get the data out there, so we'd produce abstracts for congresses, and then if they get accepted, we'd then do like a scientific poster, which I tend to find was more the exciting bit. You could do things a little bit more creative. How can you present this data really succinctly, but also and really clearly, make nice figures that draw people's attention and stuff like that. So
Okay,
that would probably
and again, maybe we should just clarify, when we're talking about publications, we're basically talking about peer review type publications, aren't we?
yes,
That's what you mean by that
yeah.
sort of publications business. And with the publications, which in a lot of people's minds is still a manuscript published in a journal, did you get very involved in the sort of the enhancements and so on that people do now, whether video abstracts and infographics and things like that, or not in your
A
case?
little bit. I did a couple of patient lay summaries and plain language summaries. So we did a couple of those. Also did a graphical abstract, which was less graphical, which what I originally thought it was, and just summarizing your abstract on a slide to really draw the reader's attention. So we did a couple of bits like that. Didn't do any video abstracts though.
Okay, just out of interest, well, let's just stick with that sort of pubs type area that you're working in. Did that get you traveling very much? Did you go to any of the conferences?
No, so the account, I think it varies from account to account, even within the company, within Avalere Health. So our account that I worked on previously, there wasn't any travel involved at all. Whereas other accounts, they do tend to travel to congresses. Very much depends on the client as to how much support they'd like. And ours was not very much, so no travel involved.
Is that just out of interest from a personal point of view? Is that something you want to get involved in?
I wouldn't mind. It's not something I'd like to do all the time. As I say, I have a little girl, so I'm a little bit tired with regard to childcare and other commitments. But I do find it interesting to go out into the world. It's something that I was used to doing as a vet, driving around all the time. So being cooped up in an office / my living room does get a little bit claustrophobic from time to time. So going out and traveling is really nice. I liked coming to the MedComms Networking event, for example.
Right. Okay. So just you touched on it. Let's come back to that. So you've done your pubs for 18 months or so, and then, as I understand it, you've moved within the company into a more of a sort of marketing, medical copywriting type of role. So just tell us a bit about that, and maybe try and compare and contrast a little bit.
So I think this role is a lot. I'm actually part of creative services now, so I'm actually I'm classed as a creative rather than being a medical writer versus working with creative. So how are they different? I think manuscripts, abstracts, it's really dealing with the raw data, and you're looking a lot more delving into the detail of those specific projects and getting the messages from them across, whereas marketing is much bigger picture, and you're also communicating things to different audiences. One thing that I was really excited about doing is being able to communicate to patients and help them with regard to medical education and help them understand more about the disease. So there's a lot more patient focused things, and then there's obviously things focused at healthcare professionals and specialists as well. So your audiences are a little bit different, but then also the content that you produce is different also. They might be a patient starter leaflet. If they're starting a new drug and you say, oh, you've been prescribed X drug for your disease, here's your leaflet to tell you all about it. It would be marketing that would produce something like that generally, or more getting involved in the interactive booths that you might see at a congress with your patient care videos and surveys and little click-through infographics and stuff.
So from what you're saying, I'm guessing there's going to be more variety of format and
yeah, a lot of variety, and I've only done it for a few weeks, so by all means I'm naive to all the different types of projects that there are, but from what I've seen so far, there is a lot more variety in the work for sure, which is something that appealed to me.
Right, I was going to say, so that's good. So that's excellent. So within a company like Avalere, you've got the opportunity to move around a little bit. Just out of interest, just touch on it a little bit. I mean, the training in a company like Avalere is I'm going to say quite good. I shouldn't be putting
Yeah.
words in your mouth, but I mean, a lot of the agencies now put quite a lot of resource behind training their staff and so on. And Avalere, I know, has its own training program, hasn't it? So are
Yeah.
you getting a sense that that's a good thing that's going to sort of support you into the
Yeah,
future?
I think particularly when I started publications being completely new, I really enjoyed the amount of support that there was. You're extremely well supported, and actually, although people talk about a lot about budgeting and timesheets and keeping to set to your hours for projects, but actually when you come in new, that tends to be something that definitely gets parked to one side for the time being, and they allow you the time that you need to make sure that you're doing the best job that you can and learning along the way without feeling pressured. And I certainly felt like my colleagues were extremely supportive when I started, alongside having a 2-week training course at the beginning, where we had some interactives both with other colleagues at Avalere Health to impart their wisdom on us, and also some external speakers to sort of brief us in all the programs we needed to use and the things we were going to be doing, which I found super useful. And then we tended to have a catch up once a week with the other people on the Medical Writers Academy to catch up and see how we were getting on.
Right. So I think that's an important message to put out there, that that this is a business that does train its people, as it were, and companies like Avalere have got good training programs. You don't just come in as a medical writer and just sort of get sat at a desk and left to sort of get on with it.
No,
There's a lot of
I
support
think,
around you.
yeah, I think that was something I was worried about, not
Mm.
having a lot of experience. I was really worried about getting given my laptop, said, there you go, and given a list of tasks to do and set to it.
Yeah.
But it wasn't like that at all. I think everybody's really well versed in exactly how you're going to feel when you're going to start. There's a lot of different people that are at various stages on the timeline from how they've been in the business. You often get set up with a buddy. So I was a buddy to someone that had started not long after me. So actually, I knew exactly what she felt like. So it was only about 6 months before.
Mm.
So I think you can seek support from people that are also quite new. So if you have a question that you feel is really stupid, you can ask it to them. But also, if you have a more in-depth question, there's people that have a wealth of experience that are also more than happy to help. And I think generally, most companies are hopefully the same. I feel like I could call someone that is 10 pay grades above me and they quite happily answer the phone and have a chat and see what was going on. No one's sort
Okay.
of above you, which is nice. It feels quite fluid.
Okay. No, that sounds good. I mean, your enthusiasm comes across, which is nice. And the variety is obviously suiting you. That's great. We might as well just say that, as I understand it, you're working 4 days a week, aren't you? So you're still doing it, or I think recently you've started doing a day a week back, looking after your horses and their teeth. Is that right?
Yes, yeah. So I was approached by a colleague that I used to work with as to whether I might be interested in doing an equine dentistry role 1 day a week earlier on in the year. And although I do really enjoy my medical writing, it's definitely the practical side I was missing. It was an itch that I couldn't really scratch whilst
Right.
being sat in front of a computer. So yeah, I've gone back out doing that 1 day a week as well, which I've been told is I've won the award for the most varied jobs.
Well, that's brilliant. As I say, it's lovely to hear the enthusiasm. So thank you very much for coming on and just talking us through your story. I think it's interesting, and it's an interesting message to go out there that maybe we can get to more vets and tell them that there's an opportunity in this area. But thank you so much. I hope I can talk for you and say you're very happy if people contact you via LinkedIn. That's the easy
Yeah,
way.
absolutely.
And you're happy to sort of maybe offer a few words of advice or whatever. But just for now, I'm going to say thank you very much, and call a close. But just give us a little wave and say bye. Thank you very much. Take
Cool.
care.
Thank
Bye.
you.